Good morning, everyone. There's lots of folks popping on this morning today, so we will get started in just a minute or two. Good morning, everyone. There's many folks popping on this morning, so we're just going to wait another minute before we get started. You should be able to hear me, but you will and see me, but I won't be able to see you. If you have any questions, you can put them in the chat box. We'll get started in just a minute. Good morning, everyone. We're going to get started in just a minute. I see the number keep ticking up on those of you who are joining us, and I'll just give others one more minute to hop on before we get started. All right, everyone, good morning. I think there will still be people popping in. We have a large audience expected today, so welcome to everyone. Closed captioning is available to you. You need to click, there's a button at the bottom of the screen that indicates the closed captioning option. If you need help with that, please just message us in the chat box. We're going to get started. We have a really full agenda this morning. My name is Lynanne Gutierrez, and I am the Assistant Director at Groundwork, Ohio. Many of you know Groundwork. We are the statewide early childhood advocacy organization in the state. Our mission is to champion early learning and healthy development strategies in the state of Ohio. We really are appreciative of you all being here this morning to talk about babies. So one of the initiatives that Groundwork manages is a coalition-driven campaign called Ready, Set, Soar, Ohio. Our coalition's made up of over 100 organizational members now that are all focused and have a shared mission, passion, and service to pregnant women, infants, and toddlers. And our goal or our mission is to make Ohio the best place to be a young child. And we know that starts with our pregnant women and families and our youngest children, our babies and our toddlers. Our mission is to serve an additional 50,000 pregnant women, infants, and toddlers in high-quality interventions by 2023. And you can learn more about our shared policy agenda and policy priorities at www.readysetsoaroh.org. There is no better way to show you why we are focused on pregnant women, infants, and toddlers and our youngest Ohio citizens than this video that will explain really the case for support here that I'll share shortly. One thing we are proud to also announce, if you haven't seen it, just recently, we are building and standing up a maternal and young child health transformation center. And certainly that will help advance our prenatal-to-five focused mission here at Groundwork, and also specifically the needs of our pregnant women, infants, and toddlers. in the health space. So I just want to share with you this partnership between Groundwork Ohio and our core funder, By3, which is Bethesda's grant initiative to transform health there in Southwest Ohio. They have really understood the need for strong advocacy and a concerted, collaborative effort across the state to advance the needs of young children and their families. This Center of Excellence is going to be dedicated to transforming health by advancing best practices to improve cross-systems prenatal-to-five health policy through rigorous stakeholder engagement and advocacy. So if you are joining us today, we invite you to be at our table, part of this work. Please stay tuned. This center will work closely with our recently launched Center for Family Voice at Groundwork Ohio, which is our way to ensure that lasting relationships with the families we serve are fostered, and that the family voice, the voice of pregnant women, young children, and families are at the center of our work, informing policy development and supporting advocacy. So if you share or resonate with our mission to prepare Ohio for a better future by building and transforming systems that improve maternal and young child health, promote health equity, and prioritize prevention through policy development, research, and collaboration, we look forward to working with you. This is a long-term strategy, so we look forward to building this with you over the years to ultimately change outcomes for young children, pregnant women, and their families. Without further ado, here's the video in voices that are not mine to tell you why we need to focus on our youngest children. Thank you.
Investing early in children paves the way for a lifetime of success. To thrive, to soar, Ohio must invest in children when it counts, when their brains are being built, when the foundation for their future is being set.
We're in a competitive world, not only locally, not only in the state of Ohio, but across the country and across the world. We need the best talent in the world to compete.
If we don't start focusing on getting people a credential, a certificate, a college degree, we won't have enough people to work in the jobs of the future.
This year in Ohio, 65% of the jobs are going to require something more than a high school degree.
We know that the healthier we are as children, the more likely we are to grow into healthy adults.
We need our legislators to invest upstream in efforts that prevent the adversities that children are at risk for experiencing.
We need to invest in our children because we know that science tells us if you invest early on, they're better prepared for school, they're better prepared for life, higher graduation rates, lower poverty, lower dropout. It's a clear business case as well as a do-right case.
Children growing up in poverty or who experience trauma need early interventions to prevent the impact of adversity from compounding.
There are certain forms of adversity that are more prevalent now than they were 10 or 20 years ago. Behavioral health conditions are significantly on the rise. Substance abuse, especially the opioid epidemic. We see children who grow up in these homes with adversity, their brains are shaped differently.
When you have a 12-year-old, a 10-year-old who is violent, that didn't start when they were 12. That started when they were 2.
Your fight or flight response, your ability to avoid danger. Those are the parts of the brain that are going to enhance. At the expense of that, the brain then carves away things like cognition and development. 10 years ago, we didn't know that.
Early intervention starts even before children are born. Ensuring pregnant women get prenatal care is an investment. It saves babies and mothers' lives.
Families can touch hospital systems, but clearly we are worlds away. I walk out my door, turn to the right, and in 0.2 of a mile is the Cleveland Clinic's front door. And this is a place where babies are not making it to their first birthday.
We rank almost dead last in the nation for healthy outcomes for children reaching their first birthday.
And we pay more per person than most other states do in the country to get those really bad outcomes. If we don't address the factors that are creating these disparities, we're going to see them continue to worsen. The disparities are unacceptable. The impact on a community's economic stability, I don't even know how to describe it.
Home visiting builds strong families, especially when families don't have support.
I think every parent wants to be a great parent, but some people don't know how to do that. And so building a relationship with the parents, having a nurse come in when the baby is born, and then teaching best practices to parents can make a great difference.
And home visiting really seems to be a way that we can partner with those families to help get them connected to services.
Any extra dollars that we can get into home visiting makes such an impact.
Children in childcare deserve high-quality learning experiences. Working families need help to afford that care for their children.
Families who have infants and toddlers, the cost of childcare, it can exceed the cost of college tuition.
Without government funding daycare assistance, I wouldn't be able to work.
There are a lot of families that work very hard. Me and my husband go to work every single day. We wake up at 5 a.m. in the morning.
Even if I had a second job maybe, or if I had a big raise at my current job, we still wouldn't be able to afford it.
If I make, $1 more, I'm not gonna be eligible for childcare. You go back to school to try to get a better position, and then if you have that better position, you're not eligible.
He comes here before he actually goes to school, because I have to be at work at 5:30 in the morning.
When I hear folks call us babysitters, I invite them to see what we do.
If communities aren't interested in the workforce of the next generation, their communities are going to get smaller and they're not going to have thriving economies. And if we believe that everybody deserves a fair, fresh start, you have to do meaningful 0 to 5 work. We're not giving everybody a fair shot. It's not fair to say by the age of 5 that someone is too far behind.
If the vision is all of Ohio's children, it has to be all of Ohio's children.
There's just a lot of compelling evidence that it's not only the right thing to do, but there's a real return on investment.
Will you support investing in our children so they and Ohio can soar?
Thank you so much, everyone, for listening to this video. This is Linan again. If you're interested, if you're not already engaged in Ready, Set, Soar, Ohio as a coalition member, I invite you to join us by going to the website readysetsoaroh.org and join us. Please reach out to the groundwork staff so that we can get you connected in with our work. We're so pleased with the esteemed panelists and speakers we have brought together here today to talk about the state of babies and Ohio state budget. So currently we are engaged in budget advocacy and deliberation. How investments will be made in young children in fiscal year 22 and 23 in our state, which begins July 1st, 2020. We have an incredible opportunity to prioritize young children in our budget, and we need all of your help and understanding and advocacy and experience with families to really elevate this at the state level. Our first folks to really set the context for you all in terms of what the state of babies is in Ohio are really esteemed colleagues from the Health Policy Institute of Ohio who are data experts. Reat, I'll let you introduce yourself and then provide an overview of really your state. Thanks so much. I'll hand it over to Reem.
Thanks, Linan. I'm actually going to get started, and my name is Zach Reat, and I'm the Director of Data Management and Analysis for HPIO. And I'm really pleased to be here with my colleague, Reem, Vice President. Just thank you so much for sharing that video, because we're going to be sharing some data today, but I think that that video really brought the people and the lives behind that data to the fore. So thank you so much. If we could move to the next slide, please. So the Health Policy Institute of Ohio seeks to make Ohio a model of health, well-being, and economic vitality by providing independent and nonpartisan analysis that's needed to create evidence-informed state health policy. Next slide. So we do that work with the support of the core funders that you see here and through engagement with a diverse set of stakeholders from throughout the state. And many of you who are on the call are engaged with our work already. And for those of you who aren't, we are very glad to meet you, and we really look forward to working with you in the future. Next slide. So these are the key takeaways that Reem and I are going to be discussing today. And to illustrate these points, we're going to be giving you a sneak peek of some data from the 2021 edition of the Health Value Dashboard. Next slide. So the Health Value Dashboard is a tool that tracks Ohio's progress toward health value. And we define health value as a composite measure of our population health and our healthcare spending. And the dashboard does that by looking at Ohio's rank and our trend performance relative to other states, and also by highlighting gaps and outcomes between groups for some of Ohio's most at-risk communities. Next slide. So in the 2019 edition of the Health Value Dashboard, Ohio ranked 46, placing us squarely in the bottom half of states. And like we heard on the video, this means that Ohioans are less healthy and that we spend more on healthcare than people in most other states. Next slide. So I'm not going to share the rank from the 2021 dashboard today, but if you're anxious to know how we ranked, unfortunately, we're not, the rank's going to be similar. We are hosting an online forum where we, with the help of some guest speakers, are going to be exploring key findings from the dashboard with a real emphasis on health equity and charting a path forward in these uncertain times. And Julia, thank you for dropping a link to register for that event into the chat. Next slide, please. So to illustrate the first key takeaway, we pulled out several metrics from the upcoming dashboard and some other data on the health and well-being of young children and women. Next slide. So the dashboard is really rooted in the research that you see represented here in this pie chart. Of the modifiable factors that influence our health, 20% is attributed to clinical care, 30% is attributed to health behaviors, and the remaining 50% is attributed to factors in the social, economic, and physical environments. Now that includes education, housing, transportation, and again, those elements in the physical environment like access to food or lead. So in evaluating health value, so in measuring health value, we look toward measures in all of these domains. Next slide. So first we'll take a look at a few of the health outcomes and prenatal care. So again, the dashboard ranks Ohio relative to the 50 states and DC. So these are ranked numbers that you'll see on these images of Ohio, and red and orange means that Ohio is in the bottom half of states. Yellow and green means that Ohio is in the top half of states. So Ohio ranks, as we heard in the video, in the bottom half of states for infant mortality and also for low birth weight births, which is a driver of infant mortality. Ohio does rank just in the top in the top half of states for prenatal care, and about 3/4 of Ohio women access prenatal care in their first trimester of pregnancy. So this underscores an important point. In Ohio, we generally see better access to care, and we know that access to care is absolutely necessary, but it's not necessarily sufficient for good health. And we really heard that theme in the video. Next slide. Ohio performs poorly on measures of childhood adversity and on other social and economic outcomes. So Ohio again ranks in the bottom quartile of states for exposure to adverse childhood experiences and number 36 for child poverty. In Ohio, about 1/5 of children experience 2 or more ACEs and or grow up in a household that's experiencing poverty. And we know that adversity and trauma and low income make it difficult for children to learn and also for parents to provide adequate support, which may explain part of the reason that less than half of Ohio's young children enter kindergarten ready to learn. Just 40% of Ohio's youngsters enter kindergarten demonstrating readiness for kindergarten as measured by the Kindergarten Readiness Assessment. Next slide, please. Ohio again performs poorly on measures in the physical environment. So America's Health Rankings, Health of Women and Children report assessed the housing lead risk by looking at the age of housing in states and found that approximately 1/4 of housing in Ohio poses a potential lead risk. Addiction, particularly addiction to tobacco and smoking cigarettes, is a persistent and preventable cause of poor population health in Ohio. And according to this recent data, about 1/5 of Ohio's children live in a household with a person who smokes. So now that I've given some background on how Ohio ranks to other states, Reem is going to move into our next key takeaway. Reem?
Good morning, everyone. Thank you so much, Zach. I don't know if you can see my camera. I do have my camera on. So hopefully that can transition in just a second. And just wanted to say thanks to Lynanne and the rest of the Groundworks team for the opportunity to talk about the importance of investing early in Ohio's children. Okay, great. So Zach just shared Ohio's overall performance on some key indicators of early child health and well-being. But when we take a closer look at this data, we also find that many of our babies, our children, are experiencing even much worse outcomes. Next slide. As Zach shared earlier, and as you heard from the video that was shared, compared to other states, Ohio ranked 42nd on infant mortality. But even more troubling, in 2019, the most recent year for which we have data, Black infants were dying at nearly 3 times the rate of white infants in our state. And over the past decade, we have really just seen these disparities widen, with the Black-white infant mortality disparity increasing by 26% from 2009 to 2019. Next slide. Even when we look nationally, Ohio's Black infant mortality rate was higher than all but 5 states with infant mortality data, and twice the rate of Colorado, which has the lowest Black infant mortality rate. Next slide. And on low birth weight, which is a key contributor to infant mortality, we see disparities compared to white infants across all racial and ethnic groups. Next slide. These disparities are really just the tip of the iceberg. They are indicators of much more deep-seated issues. And at the bottom of the ocean, far below the surface, the research evidence is clear that racism and other forms of discrimination, such as ableism, xenophobia, are individually and in conjunction with one another, driving gaps in outcomes for many of Ohio's children. Next slide. Here you see the various ways that racism and other forms of discrimination can impact health. And the impacts can manifest both directly through increased exposure to toxic stress, as an example, as well as indirectly by fueling policy and system inequities that result in Ohio's most at-risk children and their families facing obstacles to accessing healthcare, as you heard earlier, to accessing education, housing, transportation, food, and other critical resources. Next slide. To give a clearer picture of what this looks like, on the left side of your screen, you see that compared to white children, parents of Black children are 17 times more likely to report that their child was treated unfairly due to their race or ethnicity. What that means is that 1 in 10 Black children in Ohio are being treated unfairly due to their race. That's 1 in 10 Black children in our state. On the right side of your screen, you can see how experiencing racism directly impacts health and can have longer-term consequences, with Black adults in Ohio being more than 5.5 times more likely to report physical or emotional symptoms as a result of treatment due to race. And that is 1 in 5 Black adults in Ohio. These measures paint a picture of how pervasive racism is in our society. And although we don't have measures for other forms of discrimination, such as ableism, the research indicates that they bear similar impacts. In addition to the direct impacts of racism and discrimination, infant and child health disparities are fueled by systems, policies, and practices that unfairly disadvantage some children and families in Ohio and result in gaps in outcomes across community conditions. Next slide. For example, here you see Black children in our state are 3 times more likely to live in poverty than white children. That's more than 1/3 of Black children and about 1/3 of Hispanic children in Ohio living in poverty. Next slide. This is a measure of food insecurity, or families that sometimes or often cannot afford enough to eat. And children of color, children living in low-income households, and children with disabilities are all much more likely to experience greater food insecurity than their peers. Next slide. And as you heard earlier, more than 1/3 of children of color and more than half of children with disabilities are likely to experience adversity and trauma at a young age. Next slide. So when we get to kindergarten readiness, an indicator of whether your child is going to be ready to receive their academic education and move forward with success are children of color, our students with disabilities, and our children coming from economically disadvantaged communities are not ready and are being left behind. What this data that I have shared makes abundantly clear is that our policies, our systems, our beliefs even favor some children in Ohio over others. And as a result, the health of our children and of our state as a whole is suffering. I'm going to hand it back to Zach to start our third and final key finding.
Thanks so much, Reem. Next slide, please. The final key takeaway from our presentation is that childhood adversity and trauma have long-term health and economic impacts. Next slide. And the HPIO is engaged in a long-term project called the ACEs Impact Project, and it's looking at the impacts of adversity, specifically adverse childhood experiences on health, healthcare spending, and other outcomes. And thank you again, Julia, for dropping links to briefs that have come out of this impact project into the chat. So what exactly constitutes an ACE differs based on the data set that you're using. But generally, adverse childhood experiences are adverse experiences like abuse or neglect, or living in a household that experiences challenges such as violence, addiction, mental illness, or disruption, such as disruption through parental divorce or the incarceration of a household member. Next slide, please. Data shows that Ohio children are more likely to experience adversity and trauma. Again, here we have data from the 2021 dashboard that shows Ohio children are more likely to experience ACEs, childhood abuse and neglect, and Ohio ranks in the bottom half of states on measures of poverty. The National Survey of Children's Health also includes exposure to racism as an ACE, and Reem shared that data with you on the right-hand side of the slide. Next slide, please. So research on ACEs, which is represented here in the CDC framework, shows that social conditions such as education, economic opportunity, and environmental factors like living in a safe neighborhood or going to a high quality school are immediate risk or protective factors for ACEs exposure. And all of these factors are measured in the health value dashboard, and we're going to take a look at Ohio's rank on a couple of them on the next slide. But research, still on that one, thanks. Research also shows, if we look at all the levels above adverse childhood experiences in this framework, that exposure to ACEs can have an impact on negative outcomes later in life. Next slide now. So this is data from the dashboard that looks at Ohio's rank on several risk factors for ACEs. And again, we're in the bottom half of states. So for example, Ohio ranks 39th out of 50 states on incarceration of a household member, which is one type of ACE. And disruptions in a household, such as through incarceration, can have negative impacts on health and other outcomes later in life. And Reem's going to talk more about our analysis to look into that. Reem?
Thanks, Zach. As Zach shared, HPIO has been working on an Ohio ACEs impact project for over a year now to better understand the extent to which preventing ACEs could improve the health of Ohioans and to identify which ACEs contribute to significant health impacts for Ohioans. Next slide. Our analysis found that just as an example of what you see here, an estimated 36% of depression diagnosis in Ohio could be attributed to experiencing 2 or more ACEs. Another way to think about this is that if exposure to ACEs were eliminated across our state, an estimated 36% of depression diagnoses could be prevented. Next slide. As I shared, one of the primary objectives of this project was to get a better understanding of which ACEs have the most significant impact on the health of Ohioans, because we know that not all ACEs are created equal in their impact. And what we found is that the ACEs in red boxes had significant health impacts on Ohioans. And these ACEs that are impacting Ohio's children are also driving significant negative long-term health and economic consequences in Ohio. Next slide. This graphic shows the extent to which certain health outcomes could be avoided if a specific ACE were eliminated. So as an example, if exposure to emotional abuse were eliminated, an estimated 16% of depression and 12% of current smoking could also be eliminated. Next slide. Focusing on the ACEs that we found to have significant health impacts could lead to $10 billion a year in healthcare spending and $319 million in lost wages being saved if these particular ACEs were eliminated. So if Ohio were successful in avoiding even 10% of the costs attributable to ACEs, more than $1 billion in spending annually could be saved. Next slide. there is a lot of work Ohio can do and to build on existing initiatives to help children and families build resilience in the face of adversity and trauma, and to address the impacts of racism and discrimination, as well as advance meaningful policy changes to improve community conditions and remove the obstacles to health and well-being that children and families in our state face. And investing early in Ohio's children and their families is a critical step to moving that forward and improving the overall health of our state. Next slide. If you have any questions about the information that Zach and I covered, you can find our contact information here. Please feel free to reach out. Next slide. We reviewed a lot of data, a lot of information, so you are welcome to go to our website or the links that you saw in the chat box to review this information and take a closer look at some of our policy briefs. We appreciate the opportunity to share this data and information and look forward to the rest of the conversation this morning.
Thank you, Reem and Zach, for that presentation. With a couple questions in the chat box, I just want to remind folks, yes, you will have access to all of the slides that are shared today and a recording of this webinar. It will be available on our website at groundworkohio.org, but you will also get an email, hopefully later today, with the content and the recording of the webinar for you to review. I am now pleased to introduce our next speaker, Director Maureen Corcoran. She's the director of the Ohio Department of Medicaid, and we're looking forward to her sharing how the Department of Medicaid under her leadership has approached the unique needs of pregnant women, infants, and toddlers in this fiscal year 22-23 budget, and how and sharing with us a little bit how stakeholders like us can engage with the Department of Medicaid to support these efforts. Director Corcoran, I'm going to hand it over to you.
Director, we are unable to hear you.
Thanks everyone for your patience. We are lucky to have our very, very busy guests with us today. So Director Corcoran, if you're speaking, we can't hear you. And we'll give you just another minute here, and then we're happy to come back to you if you're unable to present right now.
Okay, can you hear me now?
Perfect, thank you.
Okay, sorry about that. All right, well, good morning, and I am glad to be with you. Thanks for having me, and I too loved the video. It's just wonderful. So I want to take, I guess I'm supposed to take about 10 minutes. I want to give you just a quick overview of budget considerations. We're actively into it, as you know, have had now testimony in the full committee and in the subcommittee. So I'm going to touch on four sort of key topics. First, I want to say a little bit to you about the larger public health emergency enhanced FMAP, kind of the underlying structure of the budget and how that is important to the overall considerations of the budget. I want to talk specifically about where we stand on initiatives about moms and babies. Just a quick headline about our managed care procurement, and a word about the American Recovery Plan that was just passed in Washington. So first, keep in mind that when the public health emergency was first initiated, we were given certain additional flexibilities and authorities. The public health emergency is actually authorized in 90-day blocks of time, it has to be reauthorized every 90 days. And associated with that then are additional flexibilities in a couple of different forms that states can use. And we have those that kind of fall into the Medicaid arena. We are using quite a number of these in our waiver area, in our general area of Medicaid, for example, with telehealth, as well as some more general flexibilities across the board. Those are important because they will at some point go away. And it's what we refer to as unwinding the pandemic. In some ways, it was a heck of a lot easier to get into the pandemic than it's going to be to get out of it when we get to the end of it. So most important for the budget purposes is to understand that just a couple of days actually before we introduced the budget, we were notified by the new administration that the pandemic would likely be continued through 2021. So that at least gave us a little bit of a horizon to plan with in terms of both these flexibilities that I'm mentioning and the additional enhanced federal money, the additional 6.2% that we get in addition to our regular federal match, which amounts to about $300 million a quarter. So from the beginning of last calendar year through this calendar year, it ends up being about $300 million a quarter times 8 quarters, about $2.4 billion, which has been very helpful and necessary in us balancing our budget and being able to provide additional services to folks that have newly joined the Medicaid program. Incumbent in that, however, was the quid pro quo, and that is that we cannot terminate anyone who was currently served on the program at the beginning of the pandemic until after the pandemic is over. So that alone has contributed and is a significant factor in what has driven up our caseload. So there has been a significant increase, about 350,000 people more than what we had, early last year. We expect that number will continue to rise, and the cost implications of it for our budget are significant. Now, why I think it's important to share that with you is that, as you know, Medicaid is a safety net program. It's particularly designed or intended that during times like this, it'll serve as a safety net. But it's also a time when we have significant economic challenges in the state. And at the same time, you've got this significant requirement for additional expenditures through Medicaid. So it is important that we continue to be vocal advocates of Medicaid as a support program for Ohioans, that we continue to explain that particularly to legislators and some of our newer legislative members who may not necessarily understand all the dynamics of Medicaid and where it fits in the importance of serving children and families across the state. The budgetary impact is quite significant. And in my budget testimony, I laid out all the different numbers. And I think it's fair to say that sticker shock is a kind way of capturing the reaction, of course, because the numbers are significant, several $billion increase over a couple of years. And so that has made it even more important for us to be having conversation with the legislature about Medicaid sort of fundamentally. And so I don't want to minimize that. I want, and I know that this audience in particular understands the importance of that, and want to just ask you to continue to bring that, what may seem like a basic message to you, but a very important message, particularly given what's going on with the pandemic. I also want to just mention that as we begin to unwind, we will be working very hard to continue to talk with constituencies and stakeholders. We have already adopted more than 180 rules. We have more than 7 different federal state plans and federal authorities that we've utilized through waivers, et cetera. And as we undo those, some of those flexibilities, we may have the opportunity to keep some, unless there is additional federal action we know that we will not be able to keep. And so we have been for some time working to begin to sort that out and to look for opportunities to use what we've learned through the pandemic as an opportunity to make permanent improvements and enhancements going forward. Telehealth being the best example of that. So we are very interested and anxious to be hearing from you, as we always are, about your experience. And again, kind of stay tuned as we begin in a more organized way, those conversations about what's helpful, what's really made a difference. We'll want then to be trying where we can to continue some of those flexibilities. With regard to the budget numbers itself or the initiatives, this budget, as you know, is not like the last where we had kind of a list of 15 or 18 different specific initiatives that were the governor's priority. And this group in particular understands that for the Medicaid budget 2 years ago, moms and babies and mother-baby dyad and family considerations was a huge component of most of those new initiatives. So we're not in that situation this time. The only real new initiative this time is a package of efforts across the departments of health, Medicaid, and aging, focused on quality in nursing homes. And I won't go through that again for this audience's benefit, but that is really our only new initiative. We also are continuing our community engagement and work activities effort. Will be implementing a voluntary program. This is something that had been required by the General Assembly. And those are really the only kind of new things that are in there. Now that doesn't diminish though what I want to share with you, and that is first of all, I feel very fortunate that unlike some of my Medicaid colleagues in other states who have had to implement upwards of 15% rate reductions for providers, we are so fortunately not in that position. That alone is a huge accomplishment and relief. But I'm also glad to be able to tell you that all of the initiatives that were committed in the last budget, those that have been fully implemented as well as those that have not been fully implemented, are all included in our continuation budget. So that means that all of the mother and baby initiatives around the PRAF, the nurse home visiting, pregnancy visit codes, comprehensive maternal care, coverage for lactation consultation, doulas, mother-baby dyad, all of that is included in our continuation budget. So, very good news in that regard. Now, some of those are not as far along in implementation as we had anticipated. Of course, given the COVID pandemic, we had a few things kind of intervene, but all of those are included. So we are working now to kind of reevaluate where we are in the progression of working on each of these and timeframes and all that. But that is also something that we're really looking forward to, is completing that work. Also included in our budget, which I also think is very important for this audience to mention, is that the complete procurement, or the next generation of managed care, as we refer to it, the re-bidding of our entire managed care program has been underway now for more than 18 months. We're in kind of the final stages of making awards and preparing to make final announcements about awards. Implementation will begin next January, kind of start up for all the new services, our Ohio RISE, which is children with multi-system needs who are in danger of custody relinquishment, as well as our managed care plans and the other components of it. All of that will be in the readiness and building stages this year with go live planned for January. That's all built into our budget. The net impact of all of that procurement, managed care procurement, is roughly budget neutral. So we were trying to be mindful of the budgetary impact there. But that's just to give you a headline from a budget point of view. But I also want to encourage you, if you haven't already, there is just an enormous amount of really phenomenal work that's been done about laying out new provider agreements and expectations around work with communities, care coordination enhancements, things that I know are also very important to this audience and to our shared interests for these moms and their children and families. And finally, again, the American Rescue Plan that was just adopted by the House and Senate in Washington. There are a number of provisions in there that address Medicaid specifically, some of which are of interest, of course, to this audience. Continuing postpartum coverage for pregnant women. There's some significant federal funds, enhanced FMAP related to community services. So there's a variety of things in there. The headline, or the reason I wanted to just mention it, is to first let you know that we are in the process of looking at it, assessing what all the potential components are that apply and where there's new flexibilities, new funding, et cetera. I also want to just mention, and I'm sure this would not be a surprise to you, that there are many questions about where we're going to need clarity, both from CMS as well as potentially from the Department of Treasury. And we're identifying those kinds of questions now so that we can make good and informed decisions about it. So we will be sending out a note pretty quick here to all of our stakeholders, just kind of letting folks know essentially what I've just said to you. But obviously, as in all of our other work with you, welcome your feedback, but we are looking at it. And of course, we'll be more than glad to talk with you about it as we sort out more of the details. So I'll stop with that and turn it back over to Lynn. And again, thanks for having me today.
Thanks so much, Director Corcoran. We really just value and thank you for your leadership during this time. And as I know it wouldn't surprise you, this group on the line and many others in our network look forward to working with you to continue to protect the Medicaid program for children and families and improve upon it, especially in those in your continuation budget as you kind of renew commitments and reevaluate how to move forward with those really critical investments in pregnant women and young children. So thank you so much. I'm now going to hand it over to Dyane Gogan Turner, who is the Chief of the Bureau of Maternal, Child, and Family Health at the Ohio Department of Health, to give us a budget perspective of how her department is meeting the needs of young children and families, our youngest children and pregnant women. Thanks, Dyane, and I'll hand it over to you.
Thank you. And thank you for the opportunity to share public health priorities and funding requests in the governor's proposed executive budget that impact maternal, child, and family health. I'm Dyane Gogan Turner. I'm the Chief of the Ohio Department of Health, Bureau of Maternal, Child, and Family Health, and serve as the Ohio Title V Maternal and Child Health Block Grant Director. I'm sharing the budget information as it was introduced and as our director testified, but as we know, the budget process is a dynamic process. ODH request approximately $1.2 billion in FY22 and $888 million in FY23 to continue advancing public health in Ohio. And this consisted of an increase to our general revenue funds. The resources will be used to expand home visiting services, reduce infant mortality, protect children from lead poisoning, combating drug use and overdose, addressing social determinants of health and improving health equity, improving population health through locally led efforts, and ensuring the safety of our residents. Federal funding makes up about 70% of our budget, and that will decline each year of the biennium, and that's expected due to a reduction in the need for federal funding for the COVID response. Next slide, please. So what an incredible video, and thank you for your partnership. As HPIO data demonstrated, all children deserve a strong foundation for a healthy future to help foster meaningful contribution in Ohio communities. Under the leadership of Alicia Leatherman, our department has continued to make great strides in efforts to reach more families through home visiting, which provides access to guidance on caring for babies and young children. Our evidence-based home visiting is proven to reduce infant mortality and promote child development and school readiness. And we provide one-on-one parenting support to expected families and parents to build confidence and knowledge and to ensure those important connections to clinical and community services. We expect to serve 8,282 families this year, which is an increase compared to previous years. In addition, families that exited our program in the past state fiscal year received services on average 28 days longer, which translates to 3 more home visits for families than exited in the previous year. And in this fiscal year, we provided services in 5 additional counties. And by the end of the state fiscal year, we will have evidence-based home visiting in all counties of our state. So in this budget, we're asking for an additional $1.95 million each year for a total investment of $41.2 million across the biennium. And this will allow us to serve 500 more families. We are also requesting a language adjustment to increase the maximum age eligibility from age 3 to age 5 to help ensure that families are able to maximize the services of the evidence-based programs. Next slide, please. Also key to home visiting and infant mortality will be leaning into other state agencies, particularly the Department of Medicaid, our national partners, but as well our local partners. As HPIO discussed, Black babies are nearly 3 times as likely to die before their first birthdays as compared to white babies. So along with Help Me Grow, our current infant mortality efforts include crib distribution and safe sleep education, neighborhood navigators who assist families in connecting them to needed services, group prenatal care, and research activities. Since 2012, our department has led the Ohio Equity Institute, which was developed by ODH and is focused in 9 counties with the highest Black infant mortality rates, connecting women to services, but also implementing upstream strategies that address the causes of infant mortality. All 9 communities are actively working to eliminate the barriers that address the root causes of infant mortality, from implicit bias within healthcare systems to improving transportation and housing. So to continue this important work, we're also requesting an additional $5.5 million in GRF for the biennium. Of this amount, $5 million will be used by the Governor's Office of Children's Initiatives to support maternal health programming by community-based and faith-based organizations. The remaining $500,000 will be used in consultation with the Department of Medicaid to develop an assessment to identify and provide much needed health and wraparound services for women. I also want to provide a brief overview of some of our federal dollars that's supporting maternal morbidity and mortality work, which will also impact efforts in improving birth outcomes and reducing infant mortality. We'll continue to support our pregnancy-associated mortality review. We've also been able to leverage additional federal dollars to support the Ohio Council to Advance Maternal Health, who will use the data from the PAMR to develop a strategic plan to address maternal morbidity and mortality in our state. Ohio has also become an AIM state, so in collaboration with our partners at the Ohio Hospital Association, we're implementing hypertension and hemorrhage quality improvement bundles across all the hospitals in the state over the next 3 years. And embedded at that is also a health equity component. To support that work, we're also implementing the urgent maternal warning signs project in WIC and then in home visiting. And that's more in-depth screening and referral to address those urgent maternal warning signs. We're also providing a variety of free trainings, including implicit bias, cultural competency for telehealth, and emergency department simulation. And through partnership with the Ohio AAP, we're also implementing implicit, which is screening parents and caregivers at the pediatric visit. And finally, as part of infant mortality, there's $2.25 million for housing for pregnant mothers. This is part of the Development Services Agency budget, and they'll be working with us alongside the Governor's Office of Children's Initiatives to support stable housing initiatives for pregnant mothers to improve maternal and health outcomes. Next slide, please. Thank you. Lead is a serious public health threat because there's no safe level of lead in the body, and even small amounts of lead poisoning can cause learning and behavior problems such as lower IQ levels, attention disorders, delayed growth, and impaired hearing. And those deficiencies can often lead to lifetime impact. It's most harmful for children younger than the age of 6, with children under the age of 3 at greatest risk. And exposure often happens through ingestion and inhalation of lead-containing materials, such as lead paint chips or dust from homes built before 1978. And because lead poisoning doesn't show early signs, it makes it very challenging to diagnose and treat. So the primary goals of our department's program is to help families, medical care providers, and communities reduce and prevent lead poisoning. The programmatic work is supported by federal grants, such as the U.S. Department of Housing and Urban Development, also supported by our Title V Maternal and Child Health Block Grant, in addition to state GRF. The governor's first operating budget invested millions of dollars in resources to address the consequences of lead poisoning, including early intervention services and a new tax credit. In September of 2019, he also established the Lead Advisory Committee, which would work to develop recommendations built on the initial investments. And these are bold recommendations to create a vision for combating lead poisoning in our state. In this budget, we are requesting additional GRF to continue and advance the lead hazard control programs that make Ohio's homes and communities lead safe. Next slide, please. First, I'm happy to share that Jamie Carmichael has joined our team as the Chief Health Opportunity Advisor to the Governor, reporting directly to our director. Jamie is also co-chairing the Governor's Eliminating Disparities in Infant Mortality Task Force that kicks off next week. The task force will build on the previous recommendations of our partners in this work, but also with a unique approach of raising the voices of our community members. As HPIO shared, we must address the social and community factors that impact health and address them in ways that ensure every Ohioan has access to resources and community conditions necessary to advance health and well-being. So a $2 million funding request will encourage local partnerships to build health literacy and to ensure that communities can obtain and understand important health information, also support and collection and analysis of data, and also create conditions that support healthy lifestyle choices. We are also expanding access to care in underserved communities by investing approximately $2.7 million per year in federally qualified health centers, or FQHCs, through the Primary Care Workforce Initiative. So this initiative provides additional providers in FQHCs, and this is done by providing students who are pursuing healthcare an opportunity to work alongside professionals as part of their required clinical rotations. And it's open to medical, dental, behavioral health, advanced practice nursing, and physician assistant students. Next slide, please. Ohio's commitment to ending the addiction crisis continues through data collection and analysis, the distribution of naloxone overdose reversal medication across the state, and efforts to improve post-overdose care. So our budget proposal includes $3.25 million for emergency department diversion and harm reduction efforts. The Governor's Recover Ohio initiative funding will support the continuation of this initiative and also includes a creation of a comprehensive system of care for patients who present in emergency departments with addiction. And it continues to support local providers' efforts in reducing accidental drug overdose and deaths. Next slide, please. Governor Dyane's executive budget also includes $25 million investment for enterprise informatics and data systems upgrades. So with this investment, our department will be able to use data and technology to advance the health for all Ohioans. We will embed data-driven decision-making into our public health policy and elevate public health by improving the return on investment. We will be working with the Department of Administrative Services, Office of Information Technology, and the Innovate Ohio platform to continue to improve our data quality and reporting. Ohio is the only state in the nation that does not license hospitals. We will be pursuing a new licensure program that will give the state a unique opportunity to create a regulatory culture of partnership, technical assistance, shared best practices, and proactive cooperation. And this new framework will give our director the ability to work with hospital partners to set standards for quality, patient health, and safety. Next slide. So finally, keeping Ohioans healthy and preventing disease are critical to creating a culture of wellness in our state and reducing healthcare costs. So our budget also proposes to expand the tobacco use prevention and cessation program. The program has 3 primary objectives. One is decreasing the initiation of tobacco use, including e-cigarettes and vaping. The second is increasing the number of Ohioans who quit tobacco. And the third is protecting Ohioans from exposure to secondhand smoke. Further, our department's My Health, My Quit youth-centered cessation program educates Ohio's youth on the risk of vaping and the e-cigarette epidemic. I also want to note that the tobacco program is an important partner to our work and our Bureau by supporting our Moms Quit for Two smoking cessation program. Next slide, please. So thank you. This is my contact information, and please follow up with any questions you have after today. Thank you.
Thanks so much, Dyane. This is Lynanne again from Groundwork. Thank you for sticking with us. We have such a full agenda for you today. And thanks again to Dyane and Director Corcoran for sharing with us really the nitty-gritty, the insights of what their departments are doing. It is our role as advocates to both protect and celebrate what has been done, but in light certainly of what we all know and share as our mission and what HPIO really brought to light earlier on in our presentation here today is that there are many, many opportunities that demand our attention, and we have to continue to build progress both during the state budget and longer term. So please know that Groundwork is looking forward to working with you to build upon those investments over the next few months. So thank you very much. And I am so excited to bring life to what both Director Corcoran and Dyane shared with you today, because both of those departments have commitments or investments focused on home visiting. So without further ado, let's listen to the people that matter the most, the families, the moms and the babies that are served by evidence-based home visiting. No better to share the impact of this incredible evidence-based program than them. So I will let the video start here shortly.
Coming home with a new baby is scary. So is being pregnant. Especially if you don't have a support system. Especially if your child has special needs.
Well, my son was in the NICU for the first week. You have so many questions, and
you never know if you're doing the right thing. When we first started, we laid out some goals for Emerson, some goals for my family life in general, and just for me. She offers so much support, not just for your child, but for you. She puts my mind at ease that he's doing great. They're going to help me get through being a parent.
I was involved with helping me grow while I was pregnant. And then also afterwards, they would talk to me about things that I would expect as I was going along my pregnancy. Things that, I should consider regarding diet. What are some goals that I wanted to set in order to put myself in a better position. The day that I was in labor, she was one of the first people that I called. I feel like without them, I don't know if I would have had the same outcome as far as health-wise. I have to, make sure that I'm doing everything that I need to do in order to be the best mother for my child.
I knew that there was something just not quite right. She wasn't saying mama. She wasn't saying dada. She was saying nothing. A couple months after we started Help Me Grow, she just started to blossom. She was saying different sounds for different things. It's gonna save the school system. She's not gonna need a therapist.
Marshall's given me the tools to be a better parent. He's teaching me how to interact with my children. I wasn't reading to my kids, and she's taught me that it's important to read to my kids so they can communicate. It helps their brain. She's a positive influence. She lets me know if you need anything, call me. I love being a mother. It's a big job.
Ian, I would still consider him mostly nonverbal. We know he has sensory processing disorder. Also, Ian has really, really bad anxiety. If I try to show him a piece of food that I'm eating, he will do everything in his power to get away from me. Sometimes he'll even gag if he smells it. I'm a different person now because of this experience. I'm more patient. Before they came, Ian and I would literally cry every day together, just trying to get him to eat a meal. We don't cry anymore. We were really, really concerned and worried that we would never hear our baby's voice. He does so many things now that I did not think in a million years he'd be doing at 3.
Thanks so much. I hope you've enjoyed this new video as much as I have, and certainly for all of you home visitors that happen to be joining us on the call today, my goodness, when I think about the one woman who said she was one of the first people I called when I went into labor, I have found nothing more powerful than thinking about that. And so thank you for the incredible work that you do. We are now pleased to be joined by a couple of incredible legislative leaders. And the first two I'll introduce is Senator Blessing. So Senator Blessing serves Ohio's 8th district, which encompasses a portion of Hamilton County. He chairs the Ways and Means Committee and is also vice chair of the Primary and Secondary Education Committee. He also serves on both the Finance and the Transportation Committees. And we've asked Senator Blessing, and we also have another guest I'll introduce shortly, but we've asked them to each share kind of their thoughts on prenatal-to-3 policy and investments in this state budget. So Senator Blessing, I'll hand it over to you.
Oh, thank you very much. I'm looking over at who's on the call, and I see my colleague Representative Russo's looking much better than I am this morning. But that having been said, I just wanted to offer up a few points that hadn't been offered up on the previous slide on what's in the budget. I mean, they did a great job. But I just wanted to offer a personal touch to the Help Me Grow program. And I do realize there's a $2 million appropriation in the budget to increase the age limit from 3 to 5. I think that's absolutely spectacular because, I mean, to me, we had our first child, Louis. He was born 8 weeks premature, spent the first 9 months of his life in the NICU. And, we're as prepared as any parent, presumably could be And even then it was a challenge. I mean, they don't come with instruction manuals, and having somebody there to come regularly and work with us, and I'll name drop it. Her name was Deborah Lee. Was absolutely spectacular. Just having somebody to come and just give us best practices and what we needed to know, was wonderful. Now you'd never know that he was in the NICU. I read to him some Dr. Seuss books this morning at the breakfast table. He's
having trouble. Oh, there you're back. I'm sorry.
Oh, sorry about that.
No problem.
But we were able to read with him at the breakfast table this morning. He's reading actually quite well now, and just absolutely taking off. And I believe Help Me Grow is in large part responsible for that, along with the good work that the folks at the hospitals did. That having been said, my focus on the budget, I know there are folks that are Medicaid experts. Early on, I kind of went the education path. That having been said, one of the issues that has been of incredible importance to me, and I've done what I can to help both on the House side and the Senate side, is with respect to affordable housing. And it's something that I'm sure all of you know is just not a sexy topic at all. Most people don't go to the legislature to fight for housing. However, it's an issue that I'm passionate about. And, last cycle, I ended up submitting an amendment to increase GRF appropriations for the Ohio Housing Trust. That was my number 2 amendment, actually, behind the Centers for Independent Living, which also an important amendment, but the Ohio Housing Trust was huge for me. In addition to that, there are other things that we can do, and one of them was this concept of recorders fees actually helping out the Ohio Housing Trust. And that hasn't changed a lot over the years. And as it turns out, House member, I know he's working on this, but so let me just back up. It was something that I was planning on working on, and I found out that Representative Hillier had a much better approach to this. So hey, if I can step back and support him in any way, I'll do that. What he was planning on doing was modernizing, how things work at the recorder's office and putting a lot of these deeds online. But in so doing, there would be a fee increase, and with that would also channel more money into the Ohio Housing Trust. And it's something to consider that a lot of times legislators will look at things in bulk, at price tags. So we've got to be very clever about finding creative ways to get money into entities like the Ohio Housing Trust. So I certainly support that. One final thing that I have been following a little bit as we go along, and it sounds like there's a lot of money in the budget for this sort of thing, is the Healthy Beginnings at Home, which seeks to provide rental assistance and housing support for Medicaid eligible pregnant women that are homeless or near homeless. And there was a study done that showed, and it kind of, when I was reading the study, I was kind of angry that, just looking at the control group, their outcomes weren't as good as the, those who did receive the supports. And it's like, that's kind of, I'd hate to be the guinea pig on something like that, but it showed what we all know, which is when you house people, especially those who are homeless or near homeless, it's going to do wonders for the pregnant women and their children. So happy to see that. I know it's a pilot project in Franklin County. I'm going to do what I can to bring that to Hamilton County as well. I think it would be a welcome addition down here, and we'll see what we can do. But for now, all eyes on the House. I will do what I can to support you guys and keep those things in the budget that are important to you when they head on over to the Senate side.
Thanks so much, Senator Blessing. And we are pleased to, this is the first virtual reward I have ever given, but we are pleased to honor you with the Fight for the First 1,000 Days Prenatal-to-3 Legislative Chance Award. We have really enjoyed, and this will be sent to you, it's not just for show, so you can keep it in your office. We have really enjoyed getting to know you, Senator, and appreciate that you're always willing to listen and learn about the needs of pregnant women, infants, and toddlers. And I never get tired of hearing your own personal story with your son. So we know you've been a committed leader in the K-12 education space and are driven to improve Ohio's school funding formula. But as you've continued those efforts, we've appreciated that you also really value and understand why investments in our youngest students are so critical to them, their families, certainly the K-12 system and the workforce of today and tomorrow. So thank you so much, and your willingness to learn more about the visiting program in Ohio. We look forward to working with you during this budget and beyond on behalf of young children. So thanks for your time today.
Indeed. Thank you so much. And yeah, that will definitely go up on the wall in my Senate office. Thank you. Thank you.
Very good. So next, I am pleased to introduce Representative Allison Russo. She serves the Ohio's 24th House District here in Central Ohio in Columbus. Representative Russo co-chairs the bipartisan bicameral Children's Caucus. She is ranking member on the House Health Committee and serves on the New Families, Aging and Human Services Committee in the House. She's also a member of the House Finance Committee and the Finance Subcommittee on Health and Human Services and state and local government. Representative Russo, please share with us a little bit about your work and your priorities during this budget process. Thanks for joining us.
Well, good morning, everyone, and thank you, Lynn Ann, for inviting me here to speak to this group. Always a pleasure to speak with our advocates in the early childhood and prenatal space. And let me just start by saying congratulations to my colleague, Senator Blessing, on his award. I certainly have enjoyed working with him on the Children's Caucus as well. So let me first start by saying that I think overall, when we looked at not only the last budget, the current budget that we're in, but the governor's proposal for this upcoming biennium, I think most of us have been very pleased with the investments in both prenatal as well as early childhood. But of course, I'm of the opinion that we can continue to do more. And so we have laid out a number of priorities, both through the Bipartisan Children's Caucus that I co-chair, as well as my caucus in terms of thinking through under Health and Human Services, some of the investments that we would like to make. First and foremost, I kind of broadly categorize, how can we support the care, the continuum of care for moms and babies? And the most powerful tool that we have in the state budget is through continued investments in our Medicaid program. We know that Medicaid covers more than half of all births in the state of Ohio. We have a powerful tool in Medicaid to both support healthy moms, healthy pregnancies, and healthy babies. And so, a couple of the things that we are continuing to push for, as well as I know our advocates like Groundworks Ohio, is can we expand that postpartum continuous coverage to 12 months? I think there is a lot of, the evidence is overwhelming. Currently, women are only eligible for up to 60 days postpartum. We know that in that those 12 months after pregnancy, not only is that good for keeping moms healthy, but also we know for future pregnancies that that is such a critical period. The good news is that because of the American Rescue Plan that was signed yesterday, there are now incredible incentives from the federal government as well as reimbursement to make this much easier for states to expand that. And so we are really pushing to make sure that Ohio is one of the first in line to be able to do that. The other way that we can use Medicaid is making sure that those perinatal support services, things like doulas and lactation consultants and midwives, are also covered through Medicaid. We know that particularly for in some of our most vulnerable and high-risk women, that having those perinatal supports throughout pregnancy and after birth are so incredibly important in improving outcomes, not only for the baby, but also for mom and reducing maternal mortality. So that is something else that we are pushing. The governor has indicated in his executive budget that he wants to, but making sure that we are ensuring access to those types of services for women. And then there's been a lot of talk about investing in infant vitality, things like continued investment in the Help Me Grow program, so that we're supporting, again, moms and babies and parents during and after pregnancy and through the first years of life. But also making investments, good public health investments, and what I call those upstream efforts, so that we can eliminate preterm birth and so that we can eliminate infant mortality. So, you know, I was mentioned by my colleague, Senator Blessing, one thing that we know we need to invest in is creating good, safe, healthy housing. And how do we increase housing security? How do we increase food security? How do we make sure that moms can get both themselves and dads can get both themselves and their children to those critical early childhood appointments, as well as prenatal visits. So making sure that we're investing in public transit. We just passed out of the House a transportation budget that increased the investments into public transit. And then also investing in lead abatement programs and making sure that children are not exposed to lead early in childhood, so that we improve their long-term outcomes. And let me just say that, you know, there are costs involved in all of these programs, but we know that when you invest in early childhood, in both the prenatal period and early childhood, for every dollar that you invest in those programs, you get a $7 to $13 return on investment. And the return on investment is higher the earlier that we commit the money. So when we're committing to this prenatal period, when we're committing to this 0 to 3 period, we are getting an incredible return on investment long-term in our state. And then I just want to end by saying that I believe strongly that as a state, we need more public investment in our early childhood education and care. One of the things that the governor has put in his budget proposal was increasing access to publicly funded childcare, the eligibility from 130% of federal poverty level to 138 and up to 150 for children with developmental disabilities. That is a great start, but Ohio is currently ranked at the bottom in terms of our eligibility. We can do much better. We would like to see that expanded to 200% of federal poverty level. I will be thrilled even if we make progress to 150% across the board for all children in this state, because we know that when children have access to good, high quality, affordable childcare early in life and education, that they start kindergarten ready to learn. We have better outcomes in terms of the 3rd grade reading guarantee, and they go on and do better in their education, as well as moving into job training and college and degree attainment. So we are really pushing for that. Again, I am thrilled that in yesterday's federally passed American Rescue Plan, there are huge investments in this space, in this early childhood and childcare space, that really open up some federal funding opportunities for us to be able to do that in the state of Ohio. And we should be taking full advantage of that, again, because the return on investment in early education care and care is so incredibly important in terms of the cost that we avoid later on when we have to deal with, you know, more interventions in school, when we don't have degree attainment, and, you know, unfortunately, when we have to, we have people who are incarcerated as well. There are lots of good studies in this space. So those are my priorities. It is very ambitious, but I think we can do it. And I think, honestly, we can't afford not to do it, is my argument, again, because of that very strong and high return on investment when we spend these monies in our state budget.
Thank you so much, Representative Russo. And of course, your expertise always shines through whenever we hear from you with the Fighting for the First Legislative Champion Award. You have been really a lifelong advocate for women and families, and you demonstrate that in every opportunity you have to lend your voice to the issues that deeply impact our families, including education, healthcare, and economic stability. And your leadership on the Children's Caucus has driven a strong and focused consensus agenda to inform members on some of these most pressing issues. You always ask the important questions in committee hearings and other public venues to learn, share facts, and ultimately problem solve. So we too share your ambitious goals. We appreciate your leadership and your accessibility. Thank you for your work. We look forward to continuing to work with you. So thanks for joining us so much. And
thank you, Lynn. And I appreciate the recognition. But you all who are on this webinar and the folks at Groundwork Ohio, you guys are really the real champions and heroes in this. So thank you. Thank you for the honor.
Thank you. Well, I hope our participants heard that loud and clear, because we really need them now more than ever. And so I'm going to have Julia from our team share our budget case for support that can share with you all some of our budget priorities. They certainly have all been mentioned throughout this webinar, but we are, again, aggressively looking to build upon the success or the current proposals that are in the budget to get more investments and stronger policies and really leverage many of these federal dollars coming into our state. So please connect with us and follow Ready, Set, Soar and Groundwork Ohio on social media. And please sign up for our weekly newsletter and register for our events at groundworkohio.org. I want to mention just in this last few seconds, we have some incredible advocacy-focused events coming up. We are not doing our normal in-person advocacy day, but we have created 2 virtual events. The first is on March 19th. It's laying the Groundwork Summit 2021, focused on the House of Representatives, where the budget deliberations are currently happening now. We invite you to engage with us, to show up, to show our policymakers how many of you are willing to come out and turn out, even in this virtual environment, to fight for the needs of young children and families. The agenda includes the governor. We'll hear from Governor Dyane himself on investments in young children. We will also hear from his newest director, Christy Burr, from she's the director of Children's Initiatives, and we will have key legislators that are involved in leading the Finance Committee and the leadership of both the House Democrat and Republican caucuses. We will have an event then focused on the Senate later and on Friday, April 23rd. We will stay tuned to continue to learn more about that agenda, but we are looking forward to having Reem, for some of you who are early educators, know her from the National Association for the Education of Young Children, and again, some really key legislators. In addition to our event, if you can't join us for the event, we will have 5-day advocacy challenges, our first beginning on March 22nd, which requires 5 minutes of your time for 5 days to do some serious work and lend your voice and elevate your experience and the work you do with children and families every day to your state policymakers, because they need to hear from you. And we have made it very easy for you to do that, and look forward to seeing you all at our events and during this advocacy challenge. Thanks so much for joining us today. Feel free to reach out to our team. We are ready and willing to partner and to share all the work that we're doing at the state level, and certainly to connect you in with state policy development. Thanks so much.